Solusi sehat keluarga Anda. www.klinikwinarto.com.
Penyembuhan wasir atau ambien tanpa operasi dan injeksi. Ribuan pasien telah tertolong. Info dan konsultasi hubungi HP atau WA 081228937009.
Hemorrhoids commonly will cause protrusion, bulging, itching, and of course bleeding, and sometimes even pain. There is a difference between internal and external hemorrhoids. External hemorrhoids are the ones on the outside. Patients will typically know about them because they typically will have folds or bulges in the skin there. External hemorrhoids are innervated much like the rest of the skin on the body, so that if one were to have a cut or a pinch or a pull at the external hemorrhoid, it hurts very badly. Internal hemorrhoids are further inside of the anal canal. At the level where the internal hemorrhoids live, there are no sharp pain sensation nerves. So if there is a bulge, for example, at the level of the internal hemorrhoids, a patient might have a feeling that they haven't completely emptied their rectum after a bowel movement. When folks come to me complaining of hemorrhoids, I will talk with them about exactly what their symptoms are. I will commonly ask the quality and the frequency of bleeding, as well as whether there is associated incontinence, bulging, or problems with itching or cleanliness. Typically, I will perform an exam in which I will look at the hemorrhoids both on the outside of the anus, as well as an anoscopic exam to look at the hemorrhoids on the inside of the anus. For an external hemorrhoid that has thrombosed, depending on the duration of the symptoms and whether the symptoms are improving or not, I will advise a patient to keep the hemorrhoid and suffer through it, or to go ahead and excise it, most commonly in the office. The most common treatment approach for internal hemorrhoids in this country is hemorrhoid banding. This is an office procedure where I place a tiny little rubber band right over the hemorrhoid, causing the blood supply of the hemorrhoid to be cut off, and then in about 4 or 5 days the hemorrhoid actually sloughs off with the bowel movement, and the patient doesn't even usually notice that this has occurred.
Dua insan bertemu muka bagai merpati sejoli berpandangan bertatapan berpasangan di persimpangan.